You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach, and I'm happy to introduce a friend of mine, Neha Taneja. We're going to talk about operations management and burnout. So, on the career side, Taneja right now is a senior business process analyst with the U.S. Department of State. We probably are not allowed to say that, but because we're on podcast, we are. She is licensed veterinary technician with VCA Animal Hospital. She's author of a partnership, How the Veterinary Industry is Poised to Transform Over the Next Decade. And that's the main reason why we were talking about this, plus the experience that was incorporated into this book. She holds an MBA degree in Health and Healthcare Administration Management from Marymount University, Bachelor of Science in Neuroscience at George Mason University. Couple fun facts. She had her start in veterinary industry as a kennel attendant. She enjoys spending time with her two German shepherds, Leo and Simba, and her hobbies include coaching basketball and participating on Bollywood dance team. Welcome to the show, Neha. It's nice to see you again.
What is a Herbie, Ivan?
Herbie, it's the Russian version of hobby.
Oh, okay, perfect. Thanks for clearing that up. It's so nice to have you here, Neha.
Thank you so much. I'm so excited to speak with you guys.
So we met before. We talked about your book, and we had sort of the brain melt on the burnout issue in the industry. And your career path is very interesting because so the MBA I also have in a similar sort of sector in healthcare administration and management, and I also started veterinary career in North America as the kennel attendant, which is the destiny of every immigrant veterinarian that comes to this country, is to start as a kennel attendant. So can you tell us a little more about your book? So a paw partnership. So for the listeners, if you want to get an awesome book about the experience from the forefront, a paw partnership, how the veterinary industry is poised to transform over the next decade. What was the reason you wrote the book? What is it about, and what are you talking about in it?
Of course. So I wrote a paw partnership in 2020. So it was a good time to write a book in the pandemic where I had some extra time. But what inspired me to write the book was in 2019, I left my full-time position with a veterinary practice just because I was approaching the point of burnout. And so recognizing those signs and just having to make a decision on, do I want to take care of myself or kind of succumb to the stressors and challenges with being in the veterinary profession. So when I took that time off from my full-time position, I reflected, and there's just so many people that I've seen succumb to burnout, compassion fatigue, just leave the profession altogether because they can't handle it anymore. And when I left, I decided, I was like, this, it shouldn't have to be this way. And that got me thinking and my wheels turning on, our profession needs more exposure and more understanding, because a lot of people don't really understand what it takes to be in the veterinary profession. So that's what inspired me to write the book. And it goes through my story from being a kennel assistant to why I started in the veterinary industry, the different roles I held. So kennel assistant, vet assistant, a customer service representative, office manager, practice manager, and even a couple of, operations management focuses that I had in our region as well. And it just takes you through my journey and the journey of others in the profession, veterinarians, CSRs, other technicians, and so on and so forth, who provide a lot of valuable insight into their perspective on the profession and how we can transform it for the future.
So this topic is very close and dear to me. I burned out myself, and I certainly remember the experience that I was going through. Can you tell us a little more? What have you felt, and what was it like to say, okay, this is going in the wrong direction, and to stop? Because as we know, as we're recording it right now, last week was certainly tragic for the profession. There was two veterinarians that took their life again. So how to recognize those signs that we're getting to this dark place, and what sort of triggered you to say, okay, I need to change something?
So I think we had a good run for a couple of years where, everything fell in place. The team was very productive. We saw our numbers go up. and our clients were happy. We had good reviews. We won a lot of recognition. And about 6 months before I decided to change my career path is when I just noticed, I was filling in a lot of extra shifts. We had a lot of staff that, was moving on to new things or moving to different states, decided they wanted to pursue something different in veterinary medicine. So slowly the team started to separate, and we had this well-oiled machine that was, maybe not so well-oiled anymore, and just trying to keep up with the, regulations and all of that. It just became, it became a lot, like trying to do more than we were able to and keeping that status quo. There were a lot of late nights, and as a practice manager, you're kind of on 24/7. So nothing, I couldn't leave anything at work. It all came home with me, and that was difficult. I didn't have as much time for my personal life or, build a support network outside of work. And it just became very overwhelming. And my personal career growth as well, I didn't really see any more career advancement opportunities that, that complemented my skill set as well. So that was also another reason that I felt it was time to look elsewhere.
Yeah, Neha, it's really interesting and it's super compelling to listen to you speak because of how close you are to this. Anecdotally, I was having a conversation with one of my best friends, who's not Ivan, and she is an ER nurse right now going through COVID. And she told me a story about how she was the most senior nurse there at 39 years old. She's the most senior nurse in the entire ER department. And she was telling me what burnout looked like in human healthcare. She's like, because everybody else is gone, we're left carrying this big burden, and, we just worry and have to do the work anyways. And it's really interesting what you said about how, you had all of these people that were leaving, and then all of a sudden there's people that stay, and all of that extra responsibility, all of that knowledge is hanging over you. So I think that that's a really interesting sign for potential of burnout, right? If you've got all of these people that were senior in your hospital that you worked with that are leaving, and you're one of the few that's left with a bunch of new people, that seems like an awful burden to carry.
Yeah, definitely. At that point, it's kind of like crisis management. You just get through the day and do what you can, but you still have the same volume, the same patients, the same, same amount of work, but now you have to train newer people and get them up to speed. And as we know, it's difficult to find, credentialed technicians and experienced people in the veterinary field and pay them appropriately. So that was definitely a huge challenge that came in the way. And yeah, it just, when you try to slow down and you need that time to regroup and reassess and train people, it really takes a toll.
So what's interesting in your story is that it kind of follows several triggers, and I like to talk about the triggers of burnout. They're sort of classic to what Maslow articulated at some point. So there's six of them. There's lack of control. So if you can't control and you don't have autonomy in your environment, if there's value conflict, if you work for the organization when your core values don't align with their core values, they're not necessarily bad or good. It's just that they don't align. Insufficient reward, which comes a lot with many people leave and few people left are underpaid for the amount of job that they do. Work overload is an important one, which happens with the situations that you described, and then unfairness in the organization and breakdown of the community. Those are sort of six classic triggers of burnout, and I can see how many of them were triggered. The interesting thing that I wanted to talk about, so recently more and more I started to focus on this problem. I started thinking about the pattern that I'm seeing, not only on why the veterinarians burn out, but more so with many people I talk to that actually didn't burn out or were thinking that they're getting there, and they treated it with a specific move that you have done. They changed the career or advanced their career. So here's my sort of thought about this. This is fairly new, but I want your feedback on this. I find that technicians and veterinarians, they're well driven by the goal of getting to this profession, and there is a passion behind treating animals. In veterinary education path, it's much longer, and many people want to become a vet when they're very young, and they set this tremendous goal like 15 years ahead. and then they pursue that goal and become veterinarian or become the technician. And then at that point, they realize that every day doesn't look like achieving anything else. It's really the churn of showing up at 9, leaving at 5. If you're not the night person, then you're overnight. There's no real goal. So what I'm focusing more on recently is looking at people that in my circle or my classmates or my colleagues that I found, and I was talking to some really interesting people that were boarded people that left the profession doing something different because they wanted to set a new goal, because the routine of doing the work is not as exciting as thinking about becoming a vet or thinking becoming a technician. Do you think there's substance to this? Do you think there's that as well, that people just lose the goal setting and they kind of get bored and burned out?
I 100% agree. I think my whole career I had something to look forward to and another milestone to achieve. And when I felt like there wasn't anything more, then, it really made me think, like, is it worth it, or where else can I pursue my passion, but actually see professional development as well?
Yeah, so I kind of bumped into this, and for the last couple of weeks I've been really thinking about it in terms of how do we, there's a lot of things that we do in burnout in terms of managing the result. There's compassion, training, there's resilience training, there's mindfulness, there's all this awesome stuff that I fully support. But then I'm trying to, approach it from the management side of things and seeing, can we prevent this? So I'm really thinking that if you'll think about the setup in the veterinary hospital, people that work in it, it's a day-to-day job without goal setting. If you think about VCA, if you think about companies we work in right now, we set annual, quarterly goals, chop it into milestones, and we achieve certain goals. And ideally, you can chop it to like minimal item where you check that box every day of item completed. As a technician or as a veterinarian, they don't have any planning. It's just like, do your job today. Here's your list of appointments. Accomplish this today, and tomorrow, rinse and repeat. So I'm thinking that, and you being a manager of the hospital, is there something that we could work with veterinarians and say, okay, so you're a producer on the day-to-day basis, but let's look at your career planning or your continuous education planning, not go to conference, attend a wet lab, and get drunk with the classmates, but let's plan to become an ultrasonographer this year or in the next 3 years. And then let's set that goal. Let's pick 2 CE events that you go to, and then chop it into quarters, chop it into months, and then day-to-day practice a new skill. So do you think that that's something we could start doing, and that might help both veterinarians and technicians to advance and not get bored with the day-to-day stuff?
Yeah, for sure. That's something my medical director and I, we actually, we would constantly put our employees on professional development plans, and I would meet with them in frequencies of either weekly, biweekly, monthly, just to assess their progress. And we would have training checklists on different tiers of being an assistant and technician and have those conversations around, is veterinary technology something they wanted to pursue, or veterinary medicine in terms of becoming the veterinarian. So, we did explore trying to set up like rotations for our employees to have them, have some insight into emergency medicine or specialty and things like that. But I think what you run into, right, is the scarcity of your technicians, and then people are afraid of losing the people that they have. And so their growth gets stumped there, which is unfortunate. But yeah, just, even not working full time, I'm just amazed at the amount of possibility and opportunity there is in veterinary medicine and all there is to learn. So I think if that was something practice owners and veterinarians could do to empower their associates and their staff, I think that would go a long way. And then, they could bring that back to their hospitals.
One of the questions that I wanted to ask you, this is a really interesting approach to dealing with burnout, writing a book, sharing your wisdom. And, the reason we wanted to have you on the podcast is it's an innovative way to solve a problem, or at least to move the profession down a path. And so my question is, did you watch Melanie Bowden's video on what being a veterinarian really takes before you wrote your book?
I actually watched it a couple months into when I started writing it, and fortunately, Melanie was very welcoming. I was able to speak with her, and we're in touch now. And I've been helping her helping provide feedback on her book that she's about to publish, I believe, in April. So yeah, I did see that. It brought me to tears, and I could relate with a lot of her points. And throughout the book, I reference her TED Talk.
It's totally awesome. So my company, Talkatoo, we work in the veterinarian space. And so it's required onboarding material for all of our employees to watch that talk, because I think it's really important if you're working in the veterinarian industry to understand what it's like. So interesting to hear that.
Yeah, no, it was a great TED Talk, and I really loved what she had to say. And just on that point, I think there's a lot of focus on veterinarian burnout and compassion fatigue and things like that. But sometimes the rest of the support staff kind of gets forgotten. So that's also a big reason I wanted to write the book, is because that takes a team to provide patient care, and there's a lot of other people under the belt that feel this as well.
I think, Ivan, that came out in your study, right? The veterinary technician.
Yeah. We've discovered that technicians are actually more burned down than the veterinarians, which I was really happy that we included everybody in the study, because I get it. Not one more vet. There's organization and everything else, but there's no. I don't think that there's significant. There's more now, but there was no significant focus on the technicians. And my whole career was very dependent on technicians and the team. And then, as the relief veterinarian, for the most part, I just showed up. They did the work, and I always, I never thought that I should take the credit for running the operations. I was always saying I just signed the papers here, and you guys do the work. Maybe not necessarily good for the owners of those practices to think that way, but it's the reality.
I think it's also really interesting. Did your study, Ivan, did it get into practice managers? Because if I'm looking at this thing from the outside and thinking to myself, who's going to carry the burden? Who's going to deal with the angry clients? It's got to be the practice manager. They've got to have a huge burden of responsibility. And I think, Neha, that's kind of what you were referencing. You're in there, you're in the middle of it, and ultimately the buck stops there in a lot of cases.
Yeah, in the study, we had some managers respondents, but they were not big enough slice to be statistically significant to make a conclusion out of it. But I agree with you, and Neha, you can probably add more color to it.
Yeah, definitely. I think a lot of veterinary technicians end up becoming practice managers, and that's because they know the medicine, they know the doctors, they know kind of the processes, and a lot of them get promoted into that position, but a lot of them might not have management training. So I've seen a lot in the recent past, practice managers especially, that are put into that position, but they don't necessarily have the knowledge or the skills on human resources or accounting, personnel management, leadership, and things like that. And that creates a lot of frustration, which throughout writing my book, there was a lot of, it's always the blame game, right? If somebody's frustrated, they see who they can blame first without looking intrinsically and seeing how can we work together as a team to resolve some of these concerns, instead of like, oh, it's the manager's job, or it's the doctor's job, or it's the receptionist's job to do this. At the end of the day, everybody's a piece of the pie and needs to pull their weight.
Yeah, Naya, that makes total sense to me. And running businesses my entire career, it totally makes sense. But, first, I want to applaud you for writing a book on a difficult subject. I think it's amazing. And second, for all of our listeners that are out there, I want to ask, what were the big takeaways? What tease our audience with some of the juicy bits of the book so that we encourage them to go off and get it.
Of course. So my, my favorite part of the book is, my personal story of when I first became a pet owner and adopted my first dog when I was 13 years old, and how she was kind of my teacher until I became a practice manager. So she was there with me through all of the big milestones in my life, and, really, really being curious about what her care entailed and what happened at the vet. That's what got my foot in the door. So starting off with that in the beginning of the book and taking you through my journey in terms of each position, what I learned. There's a lot of tasks that you learn in the workplace, like, for example, mopping a floor. I didn't know how to wring out a mop until I worked as a kennel assistant. So we've got some fun stories like that. Going into, deeper concerns. I worked with a veterinarian who had mental health issues, and a lot of the classic signs, when you're in your 20s, it's not something you're trained to recognize or even understand. Mental health is something you're still learning at that time. So there's a story in there about, my interactions with a veterinarian who had some mental health concerns, and at times that vet would lash out on the staff members or take her anger out on the people that the veterinarian was working with. But everybody reacted and they would get upset. They're like, we don't deserve to be treated like this. And unfortunately, this veterinarian ended up trying to take her life in the clinic, and that was very traumatizing. So we get into that in the middle of the book. And then in the last two parts of the book, I talk about ways on how we can support each other and implement certain systems to prevent burnout. As Ivan mentioned, prevention is key. We recommend it for our patients. We should recommend it for veterinary professionals as well. So I talk about operations management, and especially some of the systems and processes I learned in my Lean Six Sigma certification, and how we can implement those in the veterinary industry, since I don't know if I've ever seen them used in the practices I've worked in. There's also information in there for pet ownership, how it looked like maybe 10 years ago and what it looks like in the future. So together as veterinary professionals and pet owners, we can support the profession. And, at the end of the day, our end goal is to make sure our patients and our pets live longer lives.
That's awesome. So all of that and much more, you guys can read in the book called A Paw Partnership: How the Veterinary Industry is Poised to Transform Over the Next Decade. Neha, we ran through all of the time already. It's been a pleasure. We learned a lot from you. I learned that Shawn has a friend, which is also new to me. And we have two questions we ask at the end, every guest. So do you have a book, a TED Talk, or any sort of material that you would like to recommend to our listeners?
Yes, there's one TED Talk along with Melanie's that I really enjoyed watching. It's by Coach James Franklin. He was a coach for Penn State football team, and it's Why We Need Core Values. That was a really great TED Talk that I saw that I think everybody would enjoy.
Awesome. That's great, Neha. So the last question is another innovator that you'd like to recommend we have on the show.
Dr. Lance Rosa, he's the founder of Drip.vet, and he developed his company along the premises. He lost a couple of colleagues to suicide, and so this was inspired in a way to prevent burnout in the profession.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinarynnovationpodcast.com. See you next week.